Hello and welcome to Colon Cancer Screening, What You Need to Know. This video project has been created by the American Indian Cancer Foundation to educate Native men and Native women about colon cancer risk and the benefits of screening. The American Indian Cancer Foundation is a nonprofit organization that was created by Native professionals in order to address the cancer epidemic we are seeing in our communities. Our story follows a man and a woman through the steps of learning about colon cancer and through various screening options. It is our hope that through this series of stories that you may learn about colon cancer risk factors and screening options so that you may make more informed decisions that can help keep our communities healthy.
Hi, dear. I was just letting you know that I'm going to stop at the grocery store and pick up a few groceries on my way back from my annual checkup at the doctor's. Oh yeah, and I'm going to stop and get the grandkids too so we can go and practice our Ojibwe down at the powwow. Okay, well, I'll see you in a little bit then. Bye.
Everything looks really good. So what I'll do is order some standard lab tests, and you're due for a mammogram, so I can order that. And the other thing that we need to talk about is colon cancer screening. Do you know anything about that?
Not really. I don't have any symptoms down there, and I don't think I've done anything to get cancer there.
Well, what I'll do is have you talk to Joy. She is the cancer screening navigator, and she'll help explain all the testing and help you make an informed decision. And then she can let me know what you've decided, and I can order tests from there.
Okay, that sounds okay.
Hi, Valerie. I'm Joy, and I'm a screening navigator, which means I teach about colon cancer and cancer in general. I talk about risk factors and screening options. So in order to talk about cancers, I have to talk about cells. Your body is made up of tiny building blocks called cells. You have heart cells that know how to beat, muscle cells that contract, and so on. Normal cells know their jobs. Most types die and are replaced as they get old. They also respect their boundaries. Now, cancer cells are very different from normal cells, and they're pretty much abnormal cells. They develop problems that make them forget what they're supposed to do. They stop respecting their boundaries and can grow into other tissues or travel somewhere they are not supposed to and start to grow. They also resist the body's attempt to get rid of them and can grow at an abnormally high rate. Now let's talk about colon cancer. Your colon and rectum are at the end of your digestive tract. Your colon's main job is to reabsorb water. Everything coming into the colon from the small bowel is liquid. The rectum holds waste until you want to get rid of it. Sometimes people say colon cancer, other times they refer to it as colon rectal cancer. This just means cancer of the colon or rectum. Colon cancer is when the cells in the colon develop problems. They turn from being organized and know what to do to being unorganized and out of control.
What kind of symptoms do people with colon cancer have?
Unfortunately, the most common symptoms are no symptoms at all. As tumors grow, they can bleed. However, usually this blood is not visible in the stool unless it is near the end of the colon. Losing small amounts of blood over a long time can make people have anemia or low blood. Symptoms of anemia can cause shortness of breath or being tired. As tumors grow, they can start to block the bowel. Here you might have more difficulty having bowel movements or abdominal pain. It is important to know that there are many medical problems that can cause blood in the stool, abdominal pain, and constipation. But if you have these, you definitely need to talk about it with your doctor. Some people are at increased risk for colon cancer, but most cases appear in people without risk factors. Things that can make you more at risk include having a family history of colon cancer, cigarette smoking,
eating a diet low in fresh fruits and vegetables and high in fat, not being very active, and being overweight. Family history is the biggest risk factor. People with multiple family members with colon cancer can have as high as 1 in 4 chance of colon cancer in their lifetime. It is important for your doctor to know if anyone in your family has had colon cancer because it can mean we need to start screening at an early age and more frequently.
What does colon cancer screening mean?
Screening means we're doing a test to see if a person has colon cancer or polyps in their colon.
Polyps are growth in the colon that are the first step to colon cancer. If polyps are allowed to stay in the colon, they can change to cancer over time. There are several ways to screen for colon cancer. Some ways are aimed to catch cancer early when it is easier to treat. Other tests can not only catch cancers early, but it can allow the doctor to take polyps out so they don't turn into cancer.
Why is it important to get screening for colon cancer?
Because screening can save lives, and certain types of exams and screenings can prevent the disease from developing.
Colon cancer is usually very easy to treat and survive if caught early. When it is early, there are usually no symptoms. Unfortunately, it is difficult to survive if it is not caught until it has traveled other places in the body. The earliest cancers can sometimes be removed without surgery. Other early cancers may only require surgery but not chemotherapy. The latest cancers are not survivable. Colon cancer is one of only a few cancers where screening can prevent the disease. Let's talk about the screening test types.
Okay, let's talk about stool tests first. I'm going to talk about the fecal occult blood test, which is FOBT. I have a kit here to show you how it works. And this potato is going to represent our stool. So let me take out the kit and show you the parts to it. So these are just sticks, which we're going to use to smear on the card. And this tissue is used to catch your stool. And here's what the card looks like and the mailing envelope.
Samples are taken from 3 stools. You use a small stick to scrape stool for the card. Take a small sample from one part of the stool and put it on one window. Then do it again from another part of the stool. You repeat this on your next 2 bowel movements. You then return the kit to the clinic by hand or by mail in one of the special envelopes provided. The test needs to be developed between 3 days and 2 weeks of taking the sample. It is very important to write the date the sample was collected on the card as well as fill in the patient information. The card should be kept at room temperature after samples are collected and not to be put in a plastic bag or other airtight storage container.
I don't really like the idea of handling my stool. I don't want to fish around in the toilet and, it's kind of gross.
Yeah. Well, that's a good question and a common concern, and there are a couple other ways of handling the stool that are less gross.
One way is to lay plastic wrap across the bowl, leaving a saddle in the middle, then put down the seat. You then place toilet tissue in the plastic wrap. After you get the sample, you empty the stool and paper into the toilet and flush. You do not want to flush the plastic wrap. A second way is to turn off the water to the toilet and flush. This will clear the water from the bowl. You then use the toilet and gather the sample. You can then turn the water back on and flush.
That sounds a little better. Is there anything I have to do to get ready for this type of test?
Well, this test can be fooled by certain medicines and foods.
You first need to avoid what are called NSAIDs for 7 days. This includes ibuprofen or Motrin, naproxen or Aleve. A daily aspirin is okay, as is Tylenol. You also need to avoid iron tablets and vitamin C tablets for 3 days. In terms of food, you need to avoid all citrus for 3 days. This means oranges, limes, grapefruit, and lemons, and their juices. You also need to avoid red meat, including game, beef, liver, and lamb. However, it is okay to eat chicken and fish.
How good of a test is this, and how much does it cost?
This test is the most affordable.
Even if you do not have any insurance, the test costs less than $10. Most insurance, including Medicare and medical assistant, will cover this test without a deductible. The FOBT test decreases the risk of dying from colon cancer by 1/3. It does not prevent the disease. It is important to know that if the test is positive for blood, that it does not mean you have colon cancer, but you could. In that case, you will need a colonoscopy to look for a bleeding source. We will talk about colonoscopies in a minute.
Are there other types of stool tests?
Yes, there are. Another type is called fecal immunochemical test, or FIT. And this is easier because there's no diet restrictions or medicine restrictions.
Eating a lot of roughage such as popcorns or whole grains the week prior to testing can make the test performance its best. There are several different types of FIT available. One type is called the Ensure test. The Ensure test uses small paintbrushes to gather the sample. First, flush your toilet prior to having a bowel movement to make sure the water is clean. After using the toilet, take one of the brushes and brush the stool for about 5 seconds. Then brush one of the windows on the test kits for 5 seconds. You then seal the card window with a provided sticker. You then repeat these steps on the next bowel movement you have. Another type is called the FIT check. This may say OC Light or OC Auto on the vial. This type of test comes with a piece of paper that you put in the toilet. The paper will float. After having a bowel movement, you will unscrew the vial. The cap is attached to a sample probe. Simply scrape the stool a few times with the probe and screw back into the bottle. As with any stool blood test, you should not use this if you have bleeding, hemorrhoids, or if you are having your menstrual cycle. After you are done, you return the kit to the clinic. This test needs to be developed within 14 days, so do not delay.
What other options are there?
Well, there are other options, and one is to look right into the colon for polyps or cancers. And one of these types is called the flexible sigmoidoscopy, or the FLEX-SIG.
In this test, the doctor uses a thin, flexible tube with a light and a camera on the end to view the colon walls. It is called a sigmoidoscopy because it allows the doctor to look at the rectum and first part of the colon, which is called the sigmoid colon.
What do I have to do to prepare for this test?
Well, since the doctor's going to be looking at the lower end of your colon and your rectum, it's going to have to be cleaned out. And so these enemas help prepare you for being cleaned out. One is taken an hour and a half before you get to the doctor's appointment, and the other one is taken 1 hour before leaving for your doctor's appointment.
The edemas come in a small bottle with a narrow tip. It contains a small amount of fluid that makes the end of the colon and rectum empty.
What happens if I have a polyp?
It will be biopsied with a tiny small instrument that goes through the scope.
If any polyps are seen, they are biopsied with a tiny instrument that goes through the flexible tube. It takes a small piece of the tissue. You will not feel that at all. The tissue is then sent to be examined under a microscope.
Why can't they just take the polyps out?
Because in order to take the polyps out, they have to clean your entire colon. If you have the type of polyps that can turn into cancer, you have to have a colonoscopy.
As we will cover next, a colonoscopy looks at the entire colon. It is important because people who have polyps in the end of the colon or rectum often have more polyps further up the colon that need to be removed. All polyps that are found on a colonoscopy are taken out, but you will not feel that.
Does it hurt?
It can be a little uncomfortable because no medicines are used.
The colon itself only feels stretching. The scope can cause some stretching, which can feel like gas cramps. These are usually very temporary and resolved quickly.
Should I be concerned about not looking at the entire colon?
Well, the test will catch about 7 in 10 people with cancers or dangerous polyps.
Also, it is recommended that those who use Flex SIGs as a screening test have a FOBT every 3 years just to add extra coverage. Now let's talk about colonoscopies. During a colonoscopy, the doctor looks at an entire colon and rectum. A long, narrow tube with a light and a camera chip is used to see the colon walls and look for cancer or polyps. To prepare for this test, you must clean out the entire bowel, which we will discuss next. This occurs on the day before the procedure. On the day of the procedure, you will check into the endoscopy center and you will probably fill out some information on your medical history. You will then be taken back to the pre-procedure area. Here you will change into a gown. You will then have an IV placed in your arm to give medication during the procedure. You will be then moved into the endoscopy suite where you will lay on the examination table. A blood pressure cuff will be attached and a little probe will be put on your finger. These monitor your vital signs during the test to make sure you're okay.
Does this procedure hurt?
Because they're looking at the whole colon and it takes longer to do, 2 types of medicines are given.
The first is called Versed, which is a short-acting medicine that makes you very relaxed and often sleepy. The second is called fentanyl. This medication is used to take away or prevent pain. Before starting the procedure, the doctor will give you both medicines. You will be given more if you tell them it is needed. It is important to know that the doctor depends on you to tell them if you are uncomfortable during the procedure.
Then what happens?
Once you're sleepy, the doctor will reveal your entire colon. If there are polyps, they will remove them and you will not feel it.
What do I do during the colonoscopy?
Your job is just to relax and take slow, deep breaths.
How do they take polyps out?
Polyps are removed in 2 ways.
What happens to the polyps?
They are sent to a doctor who specializes in looking at tissues through a microscope called a pathologist. The pathologist tells your doctor what kind of polyps they are and if any cancer is seen in them. The doctor then takes the report from the pathologist and makes a recommendation as to when you should have your next colonoscopy.
When will I be due for my next colonoscopy?
It depends on the number, size, and type of polyp and your family history.
If no polyps are found and there is no family history, you will not need any colon cancer screening for 10 years. There are two major types of polyps. One type is not precancerous. These are called hyperplastic polyps. They do not make it necessary for more frequent colon cancer screenings. Anomalous polyps are the precancerous types. If you have these types of polyp, you will need to come back sooner than 10 years. It may be 5 years or 3 years depending on the size of the polyp and whether they have any other concerns. Your doctor will tell you when you should have your next colonoscopy. No, people who form this type of polyps tend to form other ones. For this reason, you should only have colonoscopies as a screening test.
What are the risks of colonoscopy?
Colonoscopy is a very safe procedure.
Your blood pressure and breathing are monitored throughout the procedure. Overall, there is a very small risk of the doctor making a hole in your colon. This could require surgery, but happens in less than 1 of 1,000 colonoscopies. Bleeding can occur when polyps are removed. If it happens during the procedure, the doctor will stop the bleeding. Rarely, a polyp site can bleed several days later. In these cases, patients may need another colonoscopy to stop it. It is also very rare, occurring in only 1 of 50 cases when polyps are removed. Medication reactions are even more rare. It is okay to take 1 aspirin per day leading up to the procedure. Patients who take Coumadin, which is also called warfarin, or other blood thinners need to make sure the endoscopy clinic knows this. It is often required for patients to hold their Coumadin leading up to the procedure. Sometimes other blood thinners need to be given. Recommendations can be different at different centers, and there are important considerations based on why we are taking the medicines. So it is very important to make sure the endoscopy center knows you are on them at least 1 week before your colonoscopy. If you have an internal defibrillator, you should also let the center know this as well. Patients on oral medications for diabetes should not take their medication the day of the procedure. Those on insulin should take a half of your normal dose before the procedure. If you have any questions about this, you should ask your regular doctor.
So now that you know all about the tests, are there any questions or concerns you have that I can answer?
Well, I've heard that cancer is a death sentence.
Well, you're not alone in thinking like that, but it's simply not true.
Colon cancer is very easy to treat and survive if caught early. The earliest cancers can be removed at colonoscopy. More advanced cancers may require surgery. If the cancer has traveled, chemotherapy may also be needed. Most people are cured when the cancer is caught early. This is usually before symptoms develop. Unfortunately, colon cancer can be hard to treat and survive when it is caught late and has traveled to other parts of the body. This is why colon cancer screening is so important.
But I feel fine.
Colon cancer usually doesn't cause symptoms in the early stages, and that's when we want to catch it.
I'm not sure I want to know if I have cancer.
Well, I hear that a lot, and the thing with cancer, it's so important to catch it earlier because it's easier to treat and survive.
There's so many choices. Stool test, Flexig, colonoscopy. What should I consider?
You're right, there are a lot of choices to consider.
Of course, your doctor can help you choose. The tests are very different in terms of their costs and the things you need to do. They are also very different in how good they are at finding cancer and whether or not they can prevent cancer. The FOBT and FIT are the least invasive, of course, because they are not procedures. They decrease the chance of colon cancer death because they catch cancers earlier. If everyone did FOBT or FIT, we could decrease colon cancer deaths by 1/3. They do not, however, prevent the disease. They are the least expensive. You will, however, need a colonoscopy if they are positive. Lastly, there is no risk of complications with FOBT or FIT. Flex SIGs and colonoscopies are more expensive and are invasive. They also have small risks of complication, though those are rare. However, flex SIGs and colonoscopies are much better at finding early cancers and allow for polyp removal, which can prevent cancer. Well, flexible SIGs are easy to prepare for. Just 2 enema versus a colonoscopy, which requires a full day of bowel preparation and some diet and medication changes leading up to the procedure. Pain and relaxing medicines are not usually given during flex SIGs, so patients can drive themselves home rather than needing a driver, though this also means the procedure may be less comfortable. Colonoscopies, on the other hand, is the test all others are compared to, because it is most effective at finding polyps and cancers. It also has the benefits of being the best able to prevent colon cancer, as polyps can be removed. Flex SIGs are less expensive than colonoscopies and sometimes more locally available. Both flex SIGs and colonoscopies are usually covered by insurance, but it is always good to check with your insurance company or health program about your coverage and co-pays so there are no surprises.
Most guidelines say a patient with a family history of colon cancer should have a colonoscopy.
Well, I've considered all the options, and I'm thinking that the colonoscopy is probably going to be the best test for me.
Great, so let's talk about the prep to get ready for your colonoscopy.
As you know, the colon and rectum are usually full of stool. The bowel prep is one of the most important parts of the procedure. The doctor wants to see your colon, not what's in your colon. In order for you to have a good exam, the doctor must be able to see all of your colon wall. Any leftover stool makes it hard to see. Sometimes patients are even sent back home the day of the procedure to drink more prep. Following the prep directions exactly is the best way to make sure you get a good exam. There are multiple types of bowel preps on the market. Most use a non-absorbable fluid to rinse out the colon. The first step are the same for all of them. First, you need to follow a few diet and medication changes leading up to your test. 7 days before the test, you need to stop taking iron tablets or iron-containing vitamins. Iron can make it hard to see your colon wall. You should also stop taking any fiber supplements. If you take blood thinners, now is the time to make sure the endoscopy center is aware of this. 3 days prior, you need to stop eating foods that are high in fiber. These include granola or fiber cereals, wheat breads, nuts, popcorn, or raw vegetables. Corn and fruits with seeds should also be avoided. The bowel prep usually begins the day prior to the procedure. On this day, you should only consume a clear liquid diet. Examples of clear liquid diet foods include coffee without sugar or cream, water, at least 8 8-ounce glasses, clear broths without noodles or meat, jello, popsicles, clear fruit juice such as apple juice. When choosing these clear liquids and foods, you need to avoid those that are red, such as red jello. These can make the bowel appear red and make it difficult for the doctor to tell if there's any inflammation present. Now that you have followed the directions about foods to avoid leading up to the prep day and have been on a clear liquid diet, it is time for the actual bowel prep. Go Lightly is a powder that when mixed with water makes a liquid that your body cannot absorb. The powder comes in a large jug. The morning of the colonoscopy, you should add water to the jug, fill into the line. You should then place the jug in the refrigerator. At 4 to 6 p.m., it is time to start your prep. To do this, you will begin drinking 8-ounce glasses of Go Lightly every 15 minutes until it's all gone. 8 ounces is the size of a standard measuring cup. You should use a timer to help remember to drink every 15 minutes. Drinking 8 ounces every 15 minutes, even if you are on the toilet, is very important in order to continue to rinse out the bowel. This will take 4 hours to drink all 16 cups. The solution is a little salty. Using a straw and making sure the liquid is cold can help a lot. It is very important to drink all of the solution. This will give you diarrhea to clean out your bowel. The diarrhea may last for up to 2 hours after the last glass. You can continue to drink and eat the clear liquid diet after your prep until 4 hours before your procedure. You can have your coffee in the morning, but remember, you must not add milk or cream. A little sugar is okay. After your prep, your stool should look clear, like urine. A little gritty material is okay, but if it is still cloudy or has solids, you should call the endoscopy center to ask what to do. Remember, a good prep is the most important thing you can do to make sure you get a good exam. A mixture of a sport drink with an over-the-counter stool softener called Marilex is becoming a popular alternative to Go Lightly. In fact, the active ingredients are the same. For this prep, you will need the following: 2 5-milligram tablets of bisacodyl, a 8.3-ounce bottle of Marilex, 64 ounces of Gatorade or Powerade. This should not be sugar-free and should not be red in color. A 10-ounce bottle of magnesium citrate. All of these items are available without a prescription. Now that you have followed the directions from the previous section about foods and medications to avoid leading up to your prep day and have been on a clear liquid diet, it is time for the actual bowel prep. Marilex is a powder that when mixed with a liquid makes a fluid that your body cannot absorb. You will want to mix the entire 8.3-ounce bottle of Marilex and 64-ounce of sports drink in a pitcher the morning of your procedure and place it in the refrigerator. Place the magnesium citrate in the refrigerator also. At 2 p.m., you start by taking 2 5-milligram tablets of bisacodyl. This is a stimulant, laxative, and starts getting your bowel ready to be emptied. At 4 to 6 p.m., it is time to start your prep. To do this, you will begin drinking 8-ounce glasses of the Marilax Gatorade every 15 minutes until it is all gone. 8 ounces is the size of a standard measuring cup. You should use a timer to help remember to drink every 15 minutes. Drink 8 ounces every 15 minutes, even if you are on the toilet. This is very important in order to continue to rinse out the bowel. This will take 2 hours to drink all 8 cups. Do not be tempted to drink more at once, as this can cause nausea. If you find the prep unpleasant tasting, using a straw and making sure the liquid is cold can help a lot. It is important to drink all of the solution. This will give you diarrhea to clean out your bowel. The diarrhea may last for 2 hours after the last glass. It is now time to go to bed. You can continue to drink and eat the clear liquid diet after your prep until 4 hours before your procedure. You can have your morning coffee, but remember, you must not add milk or cream. A little sugar is okay. 4 hours before your scheduled colonoscopy, you will need to do a final rinse. You do this by drinking the 10-ounce bottle of magnesium citrate. This clears the bowel of the bile that may have accumulated overnight. Again, making sure it is cold and using a straw can help if you do not like the taste. After the prep, your stool should look clear like urine. A little gritty material is okay, but if it is still cloudy or has solids, you should call the endoscopy center to ask what to do. Remember, a good prep is the most important thing you can do to make sure you get a good exam. For the flexible sigmoidoscopy, you will need to clear out the stool from the last 2 feet of your colon. This is done using fleet edemas. You will need to get 2 fleets saline edemas. Edemas are liquids that is squirted into the rectum to make you have a bowel movement. They come in a bottle with a long, narrow tip to allow you to place the liquid into your rectum. There are no dietary restrictions leading up to your exam. You should let the endoscopy center know 1 week in advance if you are taking Coumadin, also called warfarin, or other blood thinners besides aspirin. They will let you know if there's anything else you need to do. 1.5 hours before you leave for your exam, insert the tip of the bottle into the rectum through your anus and squeeze the bottle to deliver the liquid. This will result in a bowel movement. 1 hour before you leave, repeat this with another edema. This will give you plenty of time to complete the bowel movements before having to leave for the procedure.
Do you have any questions?
No.
Well, just know that you can call us anytime if you do have any questions.